Hello, my name is Bryson, and today I'll be demonstrating how to do wound care and a sterile dressing change. So prior to this, I already gathered all my materials. I have my gauze to go ahead and wipe up the area after we irrigate it. I also have the Q-tips or the cotton swabs with the increments on it so we can measure the depth of the wound. And also have the wound care tray with everything else we need inside and a pair of gloves to work with the patient. Today we're dealing with Miss DeLong, so the provider has ordered us to go ahead and give her a new dressing and also to kind of care for the wound itself. I read her file. She doesn't have anything particular that she's allergic to, but I am going to ask if she's allergic to latex, iodine, or any sort of adhesive. All right, now that we have that out of the way, let's go ahead and introduce ourselves to the patient. Hey, Ms. DeLong, how you doing? Doing fine? Okay, I'm gonna go ahead and just close up this real quick so we can go ahead and provide some privacy. My name is Bryson, and today I can provide you some nursing care. But before we get started, may I please have a name and date of birth real quick, please? Gotcha. I'm just going to take a look at that wristband real quick. Just a second. Okay. Okay, good. Okay, so the doctor has provided, or has ordered us to provide you with wound care and give you a new dressing. To my understanding, I've heard that another nurse already came in here to remove your previous dressing. Is that true? Perfect. So you just have it out? All right, gotcha. And I also know that you're on payments, correct? So currently, on a scale of 1 to 10, how bad is your pain? A 2? Okay, good. And are you on medications right now to go ahead and deal with that? You just took it a couple minutes ago? Perfect. All right. Okay. Yeah, that's the way. Let's go ahead and just take a look at that dressing, or not that dressing, but the wound, okay? Way. I'm gonna have you just raise your arm up a little bit. Thank you. Okay, let's go take a look at this wound right here. All right, around as well. All right, so I'm looking at the wound right here. I could already notice that there is some necrotic tissue surrounding the area and some erythema surrounding that necrotic tissue, but I also noticed some granulation as well, which means that the wound is healing well, so that's good. Other than the necrotic tissue and the redness, I don't see any prevalent drainage, so there's no signs of infection. I just see serosanguinous fluid. It's kind of normal. All right, let's go ahead and just measure that out real quick. Let's go ahead and just pull out our waste bag to make our job easier. I'm just gonna leave that right there, okay, Mr. Long? Yeah, thank you. Okay, let's also go ahead and pull out our little measuring thing right here. All right. Okay, let's take a look at that wound. All right, I'll say about like maybe 12 centimeters long and I'd say 3 centimeters wide. Okay, got that done. Let's go ahead and just start irrigating that wound, get that place cleaned up a little bit. Top to bottom. There we go. Okay. We got some gauze to go and just wipe that down real quick, just around the area. Let's go clean up that side. Perfect. All right, throw that away. Now we can go ahead and measure the depth of the wound. Okay. Measure the wound real quick. Measure the depth there. Compare it with this. 0.3 centimeters. Okay. All right, we're good. We got that out the way. Let's go ahead and prepare that sterile procedure and get you a change of dressing, okay? Bring this around as well. Let's open this up. Okay, I'm just gonna leave my gloves right here, okay, Mr. Long? All right, thank you. Pull out our sterile field as well. Okay, side right there. Up there. All right, let's go ahead and set up our gloves as well. go ahead and set up everything else. Go throw this away. Right below us. Okay. Now, let's go ahead and do that. Usually we wouldn't want to reach that low when grabbing something, but in that case, you can keep your hands up above. All right. Okay. That out the way. Let's go ahead and pull our things out. So we have our tape. We also have our ABD pad right here. Flat. Okay. We also have our gauze already set up in there. Side. Okay, now we're ready to go ahead and pack the wound site. Oh my gosh. These are kind of thick, so we'll just go ahead and lay that down right there. This is a pretty shallow wound, so seeing how much surface area this already covers, I don't think we might need much. So we can go ahead and try to give out another one here. So we can pack it in. Okay. Let's say maybe 2 is enough right here. So once we get that packed, probably do a good job on that, but as I said before, it's a shallow wound. This could be our last one here. Now that we have that done, we can go ahead and just break sterile field. All right, get that last one packed in. All right, let's go ahead and pull this off here now. Again, as I said before, it can be packed a bit better, but it is a shallow wound, and we were supplied a lot of gauze. So we're just gonna go ahead and deal with what we can here. Let's go and grab our ABD pad here, place it on top. Get this out of the way real quick. Okay, just leave it like that. Okay, grab our tape here. Go. Okay. Now we also have to label it. I have my name, my initials, the date, and the time of the procedure was done. Go ahead and just lay that on top right here. All right. Put that away right there. Okay. Let's go ahead and get everything set up again. All right, Mr. Long, we provided you new dressing. Got that cleaned out for you. Go ahead and put your arm back down for me. Thank you. I'm gonna lower you back down real quick. All right, so if you start to notice signs of infection, such as your site smelling horrible and or you start to feel sick or you see more redness around the area, please let us know. And go ahead and provide you your call bell right there. And just make sure to let us know, okay? All right, so what are the signs and symptoms of infection? Permanent drainage, got yourself drainage that smells bad, okay. What's some other things? Start to feel sick, a fever, okay, yeah. What's the other thing? Say that one more time again. Okay, gotcha. There's redness around the site. Perfect. Okay, so with that procedure out the way, we'll go ahead and discard all of this inside the same biohazard bag and or a different designated trash can. And I'm gonna go ahead and document the assessment and also document the procedure. So as for the assessment, I'm gonna go ahead and document the actual dimensions of the wound and of course any actual assessments that I'm making. So like any tissues right there, any like, as I said before, like scar tissues, anything like that, any drainage of sorts. But that will complete our procedure.